Hello everyone. So, right now I'm currently in the middle of Vlogmas, as I'm sure my subscribers know, but I wanted to take a minute to actually do a proper transition update video. Most especially since today, December 13th, is the anniversary of the first day that I took my testosterone blocker. Woo! I consider this the start of my hormone removal therapy, not my hormone replacement therapy, which I started on January 2nd. But yeah, the bottom line is I've been doing this for a year now, which is pretty unbelievable to me. I mean, it does not feel like, okay, in some ways it absolutely feels like a year, but in other ways it really doesn't. Time flies when you're growing. Anyway, I keep talking about how ridiculously happy I am, and that has not faded at all. I just can't believe how much better my life is than I ever imagined possible. That having been said, I will now spend the next 10 minutes complaining about all the things that are going wrong. No, it's actually some pretty mixed news this month, so that's good. Or I guess not purely bad. So the first thing I want to update you on is my medical stuff. I did go to see my endocrinologist, and actually they substituted her out with a different doctor that day, so I wasn't totally comfortable with that, but they took my blood and they, without even getting the results back, said, yeah, we're gonna just up your estrogen dose, which is now 60% higher than it was back then, which is the most significant increase I've had since I started, which is really saying something. So I'm really, really happy with that. It's a thing that endocrinologists treating trans patients will be scared to give you actual high doses of estrogen, and it's like, yeah, that's kind of the thing I'm here for. You know, they're always like, oh, we don't really know what this will do to you. And I'm like, the same thing it does to every other woman who has these levels. Just give them to me. I'm just really happy that I got away from my first endocrinologist and onto this one who actually wants my levels to be correct, which I know probably sounds like, yeah, of course, that's what you want. It's like, yeah, but it's not a given. You'd be surprised how often that just doesn't happen. So yeah. For the past 2 or 3 weeks now, I have been running on a 60% higher dose of estrogen. I feel great. So they took my blood on a Friday, which is 2 days after I do my shot, which is kind of the highest point in that cycle, apparently. So I got a crazy high number. I got like a 700, which is really, really high. It's almost double the highest level they expect for ovulation, which puts me firmly in the category of first trimester of pregnancy. So yeah, at least on that day I was technically pregnant. They said they wanted to see me 3 months later, but then they called me 2 weeks later and said, yeah, we'll see you in 2 weeks. I'm like, wait, what? And they're like, yeah, it says right here, we'll see you in a month, and you don't have anything scheduled. I'm like, yeah, of course I don't have anything scheduled. Because you said you'd see me in 3 months. This is 1. I think what's going on is that they want me to come in and get tested at a time that makes more sense for when I do my shot so they can actually get a useful number. But I don't know. Maybe I'll get to see my actual doctor this time. That'll be nice. I don't know. We'll go from there. The other downside of seeing a different doctor the day of my appointment is that she sent in a prescription to my pharmacy with the higher dosage, and my pharmacy needed to get in touch with her. Apparently they're having trouble tracking down the concentration of estrogen that I do, so they want to do a higher dose of a lower concentration to balance it out. But since it is a different prescription, they need to get approval from the doctor. And when they called my doctor, the one I saw that day who wrote the prescription, her practice was like, we don't have a record of ever seeing Mia. And I'm like, yeah, of course you wouldn't. But I heard from my pharmacist and I told them to call where I go to see my endocrinologist, and they were like, I haven't heard anything back. So apparently it's on order? I don't know, it's really confusing, and this is why I stockpile my estrogen, because stuff like this happens every once in a while, and if I had to cut back on my estrogen, I would not be a happy girl. So yeah, I'm good. I've got enough to get through. I've got plenty. I'm good to go. It's just frustrating. I don't know. I'm still debating changing pharmacies because I'm not totally satisfied with this corporation. I love my pharmacist, but I hate the company they work for. So I guess we'll see what happens there. Either way, I see my proper endocrinologist in a week and a half, so I'll be able to talk through all of this with her, and we'll get it sorted. We'll take care of it. Breaking news update. I literally just got a text update that says it's on order, so we'll see what happens. So I'm actually going to break with tradition and talk about my bottom surgery next. I actually called to schedule my consultation for my bottom surgery. Woo! Me being me, I like options. I called multiple places. The first surgeon that I called scheduled me 15 months out So that's 2021. That's a long time to live like this. And I was only able to get in that early because they had a cancellation. You know, to go over the economics of this, there's a high demand and a low supply of people who perform this surgery. That's basically the problem. And apparently this particular surgeon is one of the best vagina makers in the country, so good for me. But it does present a problem of having to wait 15 months, but actually, I was thinking about it, and that might actually be a good thing because it gives me time to explore other options. It gives me time to do the hair removal that I need to do, which I have not started on. And most importantly, it gives me time to get together the letters that I need in order to get this surgery approved by my insurance company and the doctors. For those of you who don't know what I'm talking about, for trans people in particular, we have to go through all these extra hoops to get, you know, trans care. When I had to start my hormones, I had to get a letter from my therapist and that sort of thing. I had to go through informed consent technically twice. Once from the doctor I was getting it from and once from my therapist to sign off on the letter and everything. And for this surgeon, I need one from 2 different therapists and one from my doctor certifying that I've been on hormones for a year. Apparently there's some medical reason that I need to be on hormones for a year before I get surgery. I don't know what that is, but sure. It's really the letters from 2 different therapists that kind of irk me about this because most people don't have 2 therapists and I happen to have 2 therapists. This isn't even going to be a problem for me. It's just the principle of like, no one gets vaginoplasty for fun. You know, I'm like, who are you protecting right now? But this is the WPATH standards for international transgender care. Now, when I called this surgeon's office, they were asking me, oh, are you familiar with WPATH? I'm like, yeah, I read it. And they're like, what? Yeah, I read it. It's like 300 pages long. It's written for doctors and medical care providers. Like, what? You read it? Yeah, of course I read it. If you had a single document that controlled your path to happiness, wouldn't you read it? It's just really technical. Well, I had to put my science degree to some use, I guess. And truth be told, of course, I skipped over the sections in WPATH that have to do with people who were assigned female at birth because I wasn't, so it's not relevant to me. But essentially, yeah, I read the whole thing. Like, wouldn't you? I don't know. I think it was kind of funny though. I was like, yeah, I'm usually pretty thorough, and they were like, yeah, we noticed. Anyway, so yeah, 15 months is obviously quite a long time. I was always going to consider other surgeons because basically I'm treating it like job interviews where if I don't like what this doctor says, I have this doctor as a backup, you know, like practice interviews, like that sort of thing. So how I actually did this was I tried to request an appointment online with both of these doctors and I heard back from the first one, but I never heard back from the second one. And like, it was supposed to be, I would get a call within 2 business days and it was on Monday before Thanksgiving, so I kind of understood that there was a holiday intervening, whatever, but like by next week after that, by Wednesday or Thursday, I was like, yeah, they should have called me back, something's wrong. So I called them and I explained to them, yeah, I put in a request for a consultation on your website and I heard nothing back, I was supposed to hear back, and they're like, really, really, really unbelievably rude to me. You know, I don't want to go too deep into specifics, but they were just really brusque and terse with me and like really just not kind or friendly or human. And like the cold callousness of a machine would be great if I was actually making progress in what I called about, which I wasn't. And ultimately they told me that I had to go through their doctor and their therapist at their trans care center in order to get a referral to get a consultation with this surgeon. And I tried. I was like, I have a doctor, I have 2 therapists, I can get the letters you need, I don't understand why you won't see me. And they were like, well, this is just how it's done. And I'm like, no, this is not how it's going to be done. Thank you for answering the phone and being rude, bye. And I wasn't sure quite how to react to that. And she was like, no, that's atypical, they don't usually do that. That's really kind of a level of gatekeeping that you shouldn't have to deal with. And frankly, that surgeon, from what I've heard, is not super great, so on to the next. But I sobbed over that, to be totally honest with you. I did not take that well. If that had been the first and only time I had called to schedule surgery consultation, I would never call again. I would just give up, and that would be a thing that I would never try again, or like it would take some work to get over that, you know? It was just really dehumanizing, really discouraging. I just did not enjoy that call at all, and I didn't even get what I hoped to get out of it, so yeah, I guess that's 1 surgeon down. The good news is that I have more on my list. I have 2 more recommended to me by my gender therapist that are closer. Technically 3, but we're not sure if the 3rd one still practices. And I have some other options that I've found that I'm going to consider. And I feel like that's what really enabled me to get through that really awful call, was knowing that no matter what, I had something scheduled with at least one surgeon. 15 months from now, but I had something scheduled, you know? Just remembering that sooner or later this surgery is going to happen really helps me push through all the other things that I need to do with it, including the hair removal that I need to get started with. Yeah, my electrologist said that it would take the better part of 2 years to do the clearing that I need to do for my surgery, and first of all, I don't think that's accurate with my particular hair situation. Second of all, no, that's far too long to live like this. I've spent the last 29 years living like this. I don't want to go another day living like this. So I actually made the decision to do laser first. And I actually know exactly where I'm going to go and who to call and how to schedule it and how to get a group on for it, because that's my way. I just haven't done it yet. So I'm going to call next week to schedule that sometime. I haven't picked a specific day, but it's going to happen. The other piece of good news that I got out of this is that a friend of mine had her surgical consultation with this same surgeon that I have something scheduled with, and found out precisely which hair we need to remove. And it's less than I thought, so hopefully it'll take less time than I thought, and we'll be able to get going with all of that and get on with my life. But having access to that information is critical, and that's why I don't really understand why this surgeon takes 15 months to have a consultation. Like, that's not the procedure, that's the consultation. I don't know, I just feel like getting me in the door and finding out if you're the surgeon I even want to pursue would be a better use of all of our time. I don't know, maybe it takes that long to see all the people that are doing the same thing I'm doing. I find that a little difficult to believe. I think that what's more likely is that I'm jockeying for position with other people going for different surgeries. So the next thing I want to update is how the book is going. I've had a couple of people ask me how that's going. It is the middle of Vlogmas and I haven't slept in 2 weeks, so I have actually managed to find some time to squeeze out an additional couple of thousand words that are probably going to get cut from the book, but I wrote them, so now I can edit them, which is the most important thing, is to just get the words out. Yeah, it's not done. It's going to take some time, but I'm really happy with how it's going so far. I'm really, really pleased with my own ability to get this out in the world and everything, and it's helping me make a lot of sense of everything, and that was sort of my point. Even if it never sees the light of day, at least I'm making sense of my own life to myself, right? And the last thing I would like to update everyone on today is the status of my quest to repair the final broken piece of my birth certificate. Now again, this isn't specifically a trans-related problem, but it was noticed by updating my birth certificate because I am trans. The short version is that I got the letter from the postmaster of the town postal office that I needed to get it from, and sent it off to the state to get the final correction made on my birth certificate, and have heard nothing. They say no news is good news, but in this case I really would like some news. However, I recognize that it's far more likely that they are off for the holidays and I won't get it until after New Year's, and that's kind of gonna suck, but the point is I've done everything I can do to get my birth certificate done, and it is not in my hands anymore. I just really hope that they hold true to their word and actually correct this with just this letter from this postmaster, because I feel like that should work. So I guess we'll find out. And that's about everything for this month. It's been kind of crazy. I love that, like, I'm in the middle of Vlogmas and complaining about how little time I have to film and edit and do all this stuff, and then I decide, you know what, I'll just throw in a second video to edit in one day. No big deal, right? Who needs sleep? Sleep is for the weak. But really, I need some sleep. But that is all for this month. I'll be back again next month with another transition update, and by then I'll have been on estrogen for a full year. Woo! So that's really exciting. And Vlogmas will continue on my channel until December 25th, so that is a thing that is ongoing and crazy and insane, and I really don't think I ever want to do it again, so next year I'll do it again. Until next time, stay curious.